Swine flu is penetrating deep into India, with the death toll now reaching 668. According to the latest figures, more than 10,000 people are affected due to the H1N1 virus. Now, over 650 cases of deaths have been reported because of the killer swine flu. Close to 10,000 people have been tested positive. Let's take a look at this India map. In Rajasthan alone, 191 deaths have in fact been reported. Then we come across to the west, Gujarat, 155 deaths have been reported from various hospitals. In Madhya Pradesh, that is central India, 90 deaths have been reported. If we cross over to the north in Punjab, 24 cases have in fact been reported. Cases of death have been reported. In Haryana, about 17. And in Uttar Pradesh, as many as 6 deaths have been reported recently. Now, this is the center as well as the northern part, but up north, completely up north in Jammu and Kashmir, also 2 deaths have in fact been reported. And now it's time for a Headlines Today exclusive. This is a reality check that we here at Headlines Today did in Delhi hospitals, important, prominent Delhi hospitals. Now, the government has in fact been making claims that there is no need to panic. The top government hospitals here, Ram Manohar Lohia, LNJP and Lal Bahadur Shastri Hospital. At RML, patients claim they are not being tested properly and there is a dearth of masks. The condition at the Lal Bahadur Shastri Hospital, which is also known as LBS Hospital, is such that the lab for swine flu testing is shut. Here's what the health minister actually had to say, both at the center as well as in Delhi.
Right from very beginning, day-to-day monitoring is being done, advisories have been given, all supports have been given, all logistic supports have been given. We have been giving them advisory for prevention. We are giving them ample amount of medicines. We are monitoring ourselves. We have found that there are approximately 1 lakh tablets in Delhi in our government hospitals and close to 1 lakh in private hospitals. I would like to appeal to the public that we should not get panicked, but at the same time remain alert.
Now let us go hospital by hospital. At the Ram Manohar Lohia Hospital in the capital, patients are complaining that they are not getting complete treatment. People coming for treatment are complaining that they are having to wait for long hours before they receive any form of treatment.
यहाँ ज़्यादा ये है कि स्टाफ के आदमी जो आ रहे हैं या वीआईपी कल्चर जो है वो बहुत ज़्यादा यहाँ पर है। जो पहले अभी एक गाड़ी आप देख रहे हो, गवर्नमेंट ऑफ इंडिया की गाड़ी खड़ी है, इसमें ये उतरे और सीधा ये अंदर वहाँ, और आम आदमी लाइन पे खड़ा हुआ है और मरने के लिए तैयार बैठा हुआ है। हम
सुविधाओं की जो हॉस्पिटल में सरकारी मिलनी चाहिए, दवाई, टेस्ट, बाकी सारी चीज़ें, मास्क, ये सब किस तरह से आपको यहाँ पर मिल रहा है?
ये सब परचेज करना पड़ रहा है मैम।
दवाई बाहर से खरीदी आपने?
दवाई कुछ बाहर से है, कुछ यहाँ से भी मिली है।
अच्छा, टेस्ट कहाँ से कराया आपने?
टेस्ट इसी हॉस्पिटल से कराया, लेकिन उसके अंदर 8 दिन डिले हुआ है, जिसमें कि मेरी बच्ची और परेशान हो गई है। H1N1 का जो हमने टेस्ट कराया था वो 11th को कराया था, लेकिन आज हमारे को रिपोर्ट आई है उसकी, इसलिए हम उसको अर्जेंट लेके भागे हैं। अगर ये रिपोर्ट हमारे को 2-3 दिन के अंदर अवेलेबल हो जाती तो हमारा बच्चा शायद पहले से और बेटर कंडीशन में होता।
All right, there are 2 other hospitals and we'll get you all the latest from there also. The LNJP hospital, where a lot of people are saying that administrative negligence is worrying those coming for treatment. Patients are not getting accurate information and appropriate care. But as far as the Lal Bahadur Shastri Hospital is concerned, when we panned our camera there, we actually saw that the lab which is supposed to test for swine flu, that lab itself is shut. These are images in fact coming in from all over the country, from Lucknow, from Srinagar, from various parts where deaths have been reported and many cases have in fact tested positive. That's the 3 window that we are getting you of the reality check that Headlines Today has done from the Lal Bahadur Shastri Hospital, from the Ram Manohar Lohia Hospital, as well as the LNJP Hospital. Those are the images on the extreme right-hand side of your screen of the testing center with the door shut. Let me quickly go across to Kamaljeet Sandhu, who joins us from the capital at this moment. Now, Kamaljeet, these are images that we are getting from the national capital region, from the national capital. These are 3 top hospitals in the national capital. Now, if this is the condition in the capital of the country, one only shudders to think what exactly must be happening in the rest of the country.
Well, absolutely, Sanket. And even though the message out from JP Nadda, the health minister, is that they should not panic, the people should be aware and should not be panicking, the fact remains that there is a panic situation, especially in the states of Rajasthan, in Telangana, in other places where there is swine flu, which is spreading very fast. There is a scare of the H1N1 virus, and obviously many are now asking whether the country was really well prepared. Many are also going to point out that the administration should have prepared at least 2 months in advance. The fact remains that the numbers of deaths, especially in the H1N1 case, is slowly reaching 600 and above mark. There are more than 10,000 people affected. Also goes to show that it is not just limited to a few states, it's also spreading pan-India. This is something which is a major cause of concern. The fact remains that there have been laboratories, even the Aam Aadmi Party saying that the lab should not be overcharging. The fact remains there is a war of words going on between the centre and the states, with each pointing fingers at each other. The fact remains there has to be a cohesive manner in which this entire H1N1 spread should be contained. That is something which the health ministry, which has been taking high level ministry meetings, is doing. There have been round checks, but definitely the way it is spreading, there has to be a certain containment, even in terms of giving public awareness messages, giving the particular messages, as well as the masks out. These are basic level information, including the medication, including the containment of this particular disease.
Absolutely. Kamaljeet Sandhu, many thanks for joining us with all the latest. Let's quickly play out once again, for the benefit of our viewers, the reality check that Headlines Today has conducted from the Ram Manohar Lohia Hospital, from the Lal Bahadur Shastri Hospital, as well as the LNJP hospitals. Remember, 3 top government hospitals in the national capital with 3 similar stories. At RML, patients complaining that there is no treatment. At the LNJP, patients complaining that there is negligence, and the ultimate at the Lal Bahadur Shastri Hospital, where the lab itself is shut, a big Harrison lock hanging.